Good evening, everyone. Thank you for joining us for our webinar tonight. I'd like to introduce our speaker tonight, Dr. James LaValle. James LaValle is a nationally recognized clinical pharmacist, author, educator, industry consultant, and clinical pioneer in the field of natural therapeutics. One of the nation's top influencers in legitimizing integrative medicine, LaValle trains thousands of physicians and other healthcare professionals each year on the application of natural therapies in their contemporary practices. He was named one of the 50 most influential pharmacists by American Druggist magazine and the 2011 Clinician of the Year by the Natural Products Association. LaValle founded Metabolic Code Enterprises to develop and launch his proprietary metabolic assessment platform for practitioners. LaValle is also the author of more than 20 books and ebooks, including his most recently released publication, Your Blood Never Lies, as well as his bestseller, Cracking the Metabolic Code and Nutritional Cost of Drugs. Any questions will be addressed after the presentation, and I'm introducing Dr. LaValle.
Great, thank you. Tonight's going to be a great topic. I mean, I have just dove so heavy into this topic for the longest time, and I think that it's important for us to kind of really look at this topic of restricted feeding, intermittent fasting, because it's starting to come out all over the literature. I mean, whether you look at, whether you're looking at, the implications in exercise and training, or before a patient goes through chemotherapy, to its implications in stem cell regeneration and then in neuron regeneration, right? There are so many areas that this type of research has really touched in the last 10 years. I think it's really going to be exciting to do the day-long program, because I think you're going to learn a lot. You've got, Dr. Mark Houston's going to be talking about fasting and intermittent fasting and fasting mimicry, and its effect on cardiometabolic disease. I mean, Felice Gersh is a wealth of information on women's health. She's going to be going through 3 or 4 clinical studies with her application of how she uses it. Likewise, I'll be doing quite a bit on how we've applied it, both in the athlete and non-athlete populations. So I think you're going to find it to be pretty exciting. So really, when you look at this, the research started coming out in the 80s that fasting could have a big impact on health, that it really can increase longevity. And then there's this whole thought of, by triggering autophagy, you are reducing atherosclerosis, metabolic dysregulation, cognitive function, or basically sparing your brain. There's not a lot of human studies that kind of sprung out of the 80s, but honestly now there is a lot starting to accumulate, and probably the biggest generator of kind of fasting type information has probably been the Keck Center for Longevity at USC, and notably one of the world's most renowned centers for longevity research. Just not what I agree with getting on the slide. So, what drives global obesity? I mean, this was the World Health Organization. It's well-fed states, right? It results in weight gain and insulin resistance, and once you get insulin resistance and you start gaining weight, all the other comorbidities line up, right? Lifestyle helps, diet and exercise, but it isn't always the key. And it takes constant vigilance. So I think it's interesting because, if you look back at how people used to eat, they used to eat breakfast, lunch, and dinner. Nowadays, we tell people we want you to fast between meals, right? And then there's all the confusion of, well, should I be eating all day? So there's so many things out there, but what's really starting to be noted is that a certain amount of restricted feed time in most people is going to do really well. And I'll share a little bit of the timing thoughts on that as we get later into the discussion here. But there's a lot of studies that are starting to show that fasting options are a good alternative to caloric restriction. which the biggest problem with caloric restriction, of course, is that most of the time people end up wasting muscle. So if they just lower calories, they can waste up to 30% of their weight loss in lean mass. And of course, and if they fall off the wagon, gain more fat back, they're on this kind of wheel of no return, because the next time they try and diet, they lose more lean mass, they lower their metabolic thresholds, they lower their metabolic capacity, and so all of that starts to compound on itself. So restricted feedings I think are interesting because of their effect on the circadian rhythm and your metabolism. And lean mass is where it's at, man. Lean mass is your currency of aging and the currency of your metabolism. So if you're, and we'll go through this in our day-long event, we'll talk about, what helps to generate lean mass, what nutrients help with generating lean mass, what peptides help generating lean mass. We'll go through all that stuff in the course day, but it's just important to note that in general today, people don't handle not eating really well. At 1900, the average meal was 1.5 meals a day, right? And they were working very heavy labor. Now, people have to have snacks between their meals, right? And a lot of it has to do with their energy indexes off. Or in other words, they're so poor at generating energy from their food, or their food is so energy poor that they need to eat more frequently. So, when you think of the term fasting, this is not new, right? Whether you think of, you know, Ramadan, there's been fasting in Indian cultures, fasting in Native American cultures. Fasting has been a kind of a long-term tradition that's been used for both health as well as for religious reasons. So obviously Hippocrates talked about, fasting and including apple cider vinegar. Greeks called fasting the physician within, all sorts of religions, of course, as I said before. So it's been used forever. But the big thing is that, I think it's interesting when we use the term fasting, because what we're really talking about in restricted feeds today, it's from like either 9 to 7 or 12 to 7, right? It's interesting how many people get benefit. Everybody's going wild about, oh, I'm doing a restricted feeding only from 9 a.m. to 7 p.m. That's how everybody used to eat. So obviously the physiology of fasting is, glucose and fat are stored as their main source of fuel. If the glucose isn't available, fat has to be burned. Periods of low food availability really are a part of the human eating experience. So one of the things that we think as a modern man has lost that faster famine effect, so that we still have it wired in us that if there's food around, we should eat it. And I got to tell you, I've seen a lot of people that behave that way, versus just eating what you need, or having seasonality to your eating, or even variation in the amount of calories that you take in day to day. Now, where this becomes very difficult is in people that are doing very heavy or active work, right? So if they're training 4 or 5 hours a day, that's a whole different world. But for the average person, remember, people ate on average about a meal and a half a day in 1900, when everything was decidedly higher labor. So there's these 5 stages of fasting. There's the feeding, the post-absorptive phase, the gluconeogenesis phase, the ketosis phase, and then protein conservation phase. If you look at here, you can see that as we go through these hours, really what starts happening is, as we start to really get rid of our glycogen, start to get after the fat, day 3 and 4 is when you really start to trigger a lot of stem cell production. And day 5, you get an awful lot of the autophagy start to occur. So what people, when they do a fast, usually in day 3 or 4, they actually get a little bit of euphoria because of the amount of stem cell production that occurs. And we'll go into that in depth, a little bit more in depth in the in our discussion at the conference. So there's different types of fasting. If you look at this, there's the alternate day partial fast, 25% of your energy needs 2 days a week, and then eat whatever you want on your non-fasting days. So, 25% of your energy needs may be, I don't know, 400, 500 calories a day for those 2 days. The problem with this is a lot of people, when you look at the studies on it, a lot of people end up overeating on the other days. So it hasn't been necessarily successful for everyone because it kind of still considers allowing for hedonic urges to take place, right? So you just kind of overeat on those other days. So you have to be disciplined. Time restricted feeding, in a time frame of about 8 hours. So then you have a 13 to 16 hour fast. So if you think of 10 to 6 or 9 to 5, I try to follow 10 to 6 if I can. Obviously, with travel, it's difficult, but restricted feed time, it's interesting when you start thinking of 13 to 16 hours of the fast. There's some experts like Dr. Longa. I remember talking to him once, and he was saying that if you start to go into that 16-hour fast window, you start to trigger too much cortisol. So it may be that just being at that 13-hour fast is maybe ideal, and you don't overdo it. So you can think of 7 to 7, 8 to 7, 8 to 6, 5 days a week, and then maybe you go noon to 6, 2 days a week if you're interested in that time restricted feeding. Then there's prolonged fasting. That's really no caloric foods or drinks and consuming minimal foods for minimal food calories for 3 or more days. Well, I just had somebody that came into me that had done 10 multiples of 5 and 10 day fasts. And what was interesting, she was trying to do it for weight loss and she wasn't losing a pound. And that was literally without any solid food. So I thought that was interesting. That sometimes you get these people that there's another reason why they have a problem. Then there's this, obviously religious fasting, which is, sunrise to sunset. LDS, 7-day Adventist, time restricted feedings practiced all the time. So the time restricted feeding, if you look at this, each 3-hour increase in nighttime fasting significantly improves glycemic regulation, reduced CRP. And then in women with a history of breast cancer, 13-hour fasting at night increased breast cancer at night. I think it's decreased. I'm sorry, I got this wrong. That it decreased their breast cancer recurrence, while longer nighttime fasting reduced hemoglobin A1C and longer sleep duration. It decreased their breast cancer recurrence. And somehow or another, when I made that slide today, it was off. I don't know if you can see this slide really well. I think it looks a little too fuzzy, but this is a super important concept, guys. We're supposed to eat in the day and sleep and fast at night. That is the way our metabolism is set up. So our hormones we release, cortisol high in the morning, thyroid high in the morning, hormones are piped out in the morning and maybe mid-afternoon, growth hormone pulsed out several times in a day. But when you look at what we're set up to do, we're set up to take in our food. We're set up to create glycogen synthesis. We're set up to improve our bile acid synthesis. We improve insulin secretion. We have more adiponectin production, and adiponectin is what turns the insulin receptor on. So if you look at the muscle, liver, and pancreas, their daytime functions are all set up to eat. And their nighttime functions are more set up to be fasting. So you do more repair. So mitochondrial biogenesis, more repair at night, more energy production at the day. And I think this is pretty interesting. So food timing really makes a difference on how long your hormones work. So people that are eating at 8, 9 o'clock at night, it's throwing their hormones off. There's no doubt about it. And you know what? This makes a lot of sense because I see a lot of people who don't necessarily overeat, but they gain weight and they're night owls or they eat a lot, they eat most of their calories after 5 p.m. So to me, this is a key thing. And we'll go into this, quite a bit when we get through our course. So the 3-week intermittent fast. So it's, when we look at this, it's the alternate day fast. One day you do 500, one day you do normal. This was just a study that showed that it improved fatty acid oxidation and weight loss, and improved insulin sensitivity, improved HDL, trigs go down, adiponectin goes up. The only thing when I talk to people about alternate day, it's hard for them to get in a rhythm, especially if they have to do business. So that's the one, critique of it. Intermittent fasting and growth hormone, 5-fold increase in growth hormone response to 2-day fasting, and improved brain-derived neurotropic factor. So we're improving neuronal budding and releasing growth hormones when we are able to fast. Now, interestingly, in the fasting mimic diet, which we're going to talk about in just a minute, it will, during the first 5 days, it suppresses IGF-1, downregulates mTOR, but then the bounce back of growth hormone the last 25 days of the month is dramatically higher. So you get your growth hormone back, your IGF-1 comes back, you become more anabolic. So it's kind of interesting. So here are the benefits, right? There's more to be had, but these are the benefits right now that cancer protective, improved cognition, GH release, decreasing neurodegeneration. This is really interesting that fasting and fasting mimicking could have a dramatic impact on sparing the brain and sparing the neurons of the brain. When you look at increasing PGC1 alpha, for example, well, that's only responsible to open up every receptor in your body. Basically, it works on every hormone receptor, every neurochemical receptor. It's an incredibly important signaling compound. So, what I like about this is it's easy for people to do. It could be a great first step for them to take control of their health. That's what I think is so powerful about it. So, what could the downsides be? Well, we're not really sure the effect on hunger hormones or the rebound on hormones. We're still looking at it. And not effective if people eat too many calories on the non-fasting days. And that's what I find when I talk to a lot of people, they end up doing. They end up gorging on their non-fast days so that they can feel okay on their fast day. So the other question is how long can people comply at alternate day fasts? That just, it's tough in a modern world. Well, that leads me to talking about the fasting mimic diet. So this is pretty interesting, and many of you may have heard Dr. Longa speak, and he's kind of the lead researcher on this at the Southern California Longevity Institute, and that's at the Keck Center at USC. And basically, I think this is fascinating, guys. He took hundreds of people over time, and he tweaked their diets to mimic the metabolic effect of fasting without them having to fast. He studied people and put the diet together that mimic the effects of fasting. I got to say it again because it's pretty powerful, without having to fast. And and I can tell you, it's amazing what we've seen with people. And I'll tell you a story of a girl that just came in, literally just came in yesterday. So plant-based foods between 770 and 1100 calories, stages of fasting, improves protectionist and rejuvenation mode. So it upregulates stem cells, improves protein autophagy. So this is a really, and proven. I mean, the research, which we'll go through the research in our course, but the research is, it's like $43 million in NIH grants, because what they see is, oh, wow, it's a food program that could help people start to feel better. So if you look at this, three randomized controlled trials, 71 completed 3 cycles of the FMD, 5 days per month for 3 months. What was noted? Fasting glucose was improved. IGF-1 and IGF-1B1, BP1 were improved. CRP was better. Stem cells improved. 5 pounds, a little over 5 pounds of weight loss, abdominal fat loss, waist circumference loss, lean body mass increase, systolic and diastolic pressures down, and total cholesterol down. Now, that's pretty powerful. And I would say that I've seen people lose sometimes way more, even in 5 days. I mean, I've had people lose 8, 10 pounds. Now, a little bit of it creeps back, but I'm telling you, it's pretty special what it does to your metabolism. So what are the things that it's been reported to, help with? One, promote longevity. There are actually patents on the fasting mimic diet for cellular longevity and cellular health and aging. FMDs, they reduce excess fat. So you access your excess fat. In general, people report that they feel, more vitality. It improves their fasting glucose. In fact, there are some studies and there are some anecdotal evidences of people getting off of their medications, of their type 2 diabetes medications. So some of that's going on. The whole hippocampal neurogenesis, makes sense, right? They're calming down the inflammation in the brain. And then improving cognitive performance, and C-reactive protein goes down, and IGF-1 is improved, and stem cells are upregulated. If you're doing stem cells, you want people doing a 5-day fasting mimic diet to really stimulate the body to make stem cells, and then when they put the stem cells in, they get a much better effect. So pretty interesting. And it also preserves bone density, which I think is interesting. If just 5 days out of the month for 3 months, and then every 2 or 3 months after that, you're doing some pretty big things for your body. One of the biggest things they talk about with fasting mimic diet is the fact of autophagy, or self-eating. So it's degrading your body's proteins, and it's helping to clear up a lot of old immune compounds and process them. So that is incredibly important for cleaning your metabolism up as you age. And this, of course, is the process of autophagy. And if you look at it, it's AMPK and mTOR driven. So, one of the big things with metformin, if you see over here on the far right, is that it regulates AMPK, modulates mTOR, and now you get you get the modulation of new protein being laid down and old proteins being eaten, basically. So when you think of autophagy, these are all of the diseases and conditions that are associated with reduced patrolling or reduced autophagy. So once again, amino acid levels, they really make a difference. So, in this particular slide, protein and amino acid restriction and longevity, there's this fine line of, you want to live long and you want to be vital. And I think that proteins, fats, and starches end up kind of being in this kind of sliding scale of value for you, but really depending on what your kind of what your genetic makeup is and what you've driven your metabolism to do. Not everybody does well on a ketogenic diet. Not everyone does well on a low carb diet. Not everyone does well on on the Atkins diet, right? I mean, it's important to note that you're trying to help people find their way so that they can get to better, more sane solutions for helping them manage their health. And of course, you can do a lot with boosting autophagy. Regular exercise does it, intermittent fasting does it, lower carb intakes, going into ketosis also can stimulate it. One of the other things that's important with with people going through chemotherapy, fasting mimic diet's pretty important. So if you look at this, studies found that 2 to 3 fasting days prior to treatment improved tolerance of treatment and outcomes, and reduced calorie intake, reduce some of the toxicities as well. So it's powerful. I mean, we had a lady in today. It was yesterday. She was in. She was wanting to lose weight before her wedding, and she'd been doing everything: going to class, eating right, counting her macros, getting on the bike. She had tried everything without avail. The first box of Prolon we did with her, she lost 8 pounds. And so she is really excited. And I think it's pretty typical that you can see people lose about 5 pounds that will actually stay off and their appetite changes. So it's interesting. The other benefits, obviously, promoting neurogenesis. That was an animal study. Cell transplantation, I'm not going to worry about. And then here, reduces autoimmunity, enhanced remyelination. Obviously, super important for MS and other neurodegenerative disorders. So this was looking at caloric restriction, 25% of calories on a daily continual basis. When you cut your calories every day, only 12% could hang on. I mean, think about that. So on the alternate day fast, the biggest problem with the alternate day fast is the fact that it's scheduling, right? It's you have to really schedule your food intake, and then you have to be careful about what your blood sugar's doing. Athletes may not be able to do the workup, right, and do that because they're working out probably 5 days a week. So you're gonna have to really find out which program really makes sense. What I like about fasting mimicry and what I've done the last I don't know, probably 6 months of using this and really tracking a lot of patients is it's easy because it's only 5 days out of the month. And then if you teach them a plant-based diet, a lot of vegetables, some lean proteins and fish, they really hold on to their weight loss. So it's 5 days a month. It's a kit that people eat. I know I like it because I can give it out to people. It's great as a revenue generator. But it also, you get the same benefits of fasting on fewer fasting days. And then time restricted feeding after your fasting really works well together. Um, Calorie restriction, just, people end up failing on it. They just can't keep it down forever. What I have found with people who have done either the restricted feed or the fasting mimic is their appetite starts to get under control. Their hedonic urges are better. So, you know, this is the slide I just love. Let's ease into this. I want you to try to fast between meals. I got to tell you guys, the biggest thing I struggle with people is getting them to, first of all, feel a difference when they diet. And what I like about restricted feeds and using FMD is that they feel better in general. I mean, once in a while, you get somebody who didn't, feel all that great, but that's pretty rare. But they feel good. There's a lot of reports of reduced inflammation and pain. They have heightened energy, and but it's getting them to that point where you get them to try it and stick to it for those 5 days. One of the problems I always had with people when I was doing HCG diets, which I'll still do them. I mean, I still will put somebody on them if I think they need them, in our clinic. It's tougher because it's a 3-week program. Whereas if you're doing this for 5 days, everybody's got 5 days in their month that they can do a dedicated, program. It's when you start to do something for 3 or 4 weeks and they have jobs, it becomes very difficult. So I would encourage you. You're going to have great research out there with Dr. Houston, Dr. Gersh, myself. Come to the program. I think you're going to learn a lot about how to, apply fasting into not just diet for weight loss, although it does help to reset hormones really well. So when you're doing bioidentical hormones, it's helpful. When you're doing, a weight loss program, it makes sense. If you're dealing with pain and inflammation, it makes sense. Even if you're dealing with addiction, it makes sense. There's a lot of areas where fasting mimic diet can have a big, broad application.
Thank you again, Dr. LaValle, for this presentation, and thank you to everyone who's joining us tonight. Everyone have a great night.
Yeah, I hope you all enjoyed it. Have a great evening. Bye-bye.